At Bassett, we have a cancer treatment center that is solely dedicated to providing our patients with the most up-to-date treatment, technology, and expertise.
For a patient with a cancer diagnosis, a multidisciplinary team of physicians is required. You need to have close collaboration, you need to have a close working relationship with all of the specialists involved in that patient. There are so many aspects to cancer care, and each one is so specialized that you do need experts every step of the way.
I often tell patients that you will not only hear from me, but you will hear from an entire team of physicians. We have a multidisciplinary cancer conference that's held every week, and we have the experts in all of the different fields: medical oncology, radiation oncology, surgical oncology. We have expert pathologists. We have our interventional radiologists, and they all come together at this conference to speak about our complex cancer cases. And so it's a team approach to come up with the best care for that patient.
I think people are somewhat pleasantly surprised when they realize all of the things that we can provide our patients here and what we do and how we do it.
So Cancer Treatment Center in medical oncology, we do treat and see patients with a non-cancerous disease like bleeding or clotting disorders, and also we treat their cancers at different stages of cancers. And with the technology we have now available, we are really able to do personalized treatment based on the genomics or the DNA structure of the cancer. So we can really personalize the therapy to the patient's cancer.
Increasing our genetic knowledge of the tumors and of the patients who have cancer. I think that is really the future in terms of treatment. Early detection and prevention are going to be the keys to, I think, maybe even eliminating cancer in the future.
There's a number of new things that we've been doing with radiation oncology. We're doing a lot with complicated external beam radiation treatments and a whole field of radiation called radiosurgery. We're also expanding the department to do treatments with radiopharmaceuticals. And specifically, there's a new paradigm of treatment called theragnostics, where patients can get a scan and they have a radiation molecule attached to another molecule that might bind to the tumor. And there are new drugs being developed where instead of just taking the picture, they're attaching a radioactive molecule that treats the tumor. And so we have several new drugs that we're being able to offer, a rural cancer treatment center to give patients some of these leading cutting-edge theranostic radiation treatments.
One of the things that surprises people that I talk to out in the community is that Bassett Healthcare System has a strong clinical trials program. We offer right now almost 20 clinical trials here at Bassett for various types of tumors. We try to bring in clinical trials that are focused on the main tumor types that we see in the region. Those things are not available, so it's really exciting to be able to offer patients potentially something that they wouldn't be able to get that would not be able to be prescribed.
Bassett has a long history of adopting newer therapies for many things, including cancer. We've even found records of patients receiving radiation therapy here in the 1920s. If Bassett were not here, patients would have to travel at least an hour, sometimes 2 hours, to get equivalent type of care.
Physically, they're sick. Some of these treatments, such as chemotherapy, can make a patient very sick. That's a long way to travel when you're not feeling well and you just want to be home, especially after getting a cancer treatment.
It's important for our patients that we are here. It's important we are here where their homes are, where their friends are. And I think our patients are thankful that we are here close to the community.
Here at Bassett, we do care for patients in a holistic manner. That is very important. We get to know our patients on every level, psychologically, medically, emotionally. We have nutritionists, social workers, spiritual counselors, palliative care. We have people who help with their transportation. We have staff who helps with their finances, with their insurance, making sure that they get whatever they need while they're going through cancer. We even have patient-specific charity funds that we can tap into to help them pay for not only medical expenses, but living expenses. So we do take care of the whole person.
When you're going through cancer, I want you to know that it's not you alone, and it's not just you and your family. We want you to focus on yourself and healing and getting better. And so it truly does take a village to actually bring good care.
You're meeting them in one of the worst times of their lives. And when you get to a point where the patient is smiling and coming in and just moving through those times, knowing that you're helping with that and knowing that you're just a part of it and offering really whatever you can is extremely rewarding.
We really treat patients the way that we would want our family members to be treated. And I get the sense that patients feel that they're part of another family here.
I think the patients feel that we are there, we're providing quality, compassionate care on a daily basis, and our people just love what they do. We hate cancer, we love taking care of people with it.
I have a special understanding as a cancer survivor of what patients go through every day, but so do the staff at the Cancer Treatment Center. And being able to witness this care and this love and compassion really makes me love my job and being a part of the team.
They are not here just to earn a paycheck. They're here to make sure the patient who walks through our cancer center gets the best personalized care possible. That's just incredible, and that's a blessing to me.